Right, let's continue now with our conversation on the national health insurance. We are now joined via Zoom by Professor Benjamin Smart from the Center for Philosophy of Epidemiology, Medicine and Public Health, University of Johannesburg. Prof, thank you so much for your time this afternoon. Now, when you look at the national health insurance bill, I mean, it does seem like a solution that will break the cycle of inequality, at least from the health sector point of view. But many have highlighted its drawbacks. I mean, is the national health insurance, the solution for universal access to meaningful healthcare services for all South Africans?
Good afternoon, and good afternoon to your listeners. I think it's a wonderful goal, universal access to high quality healthcare. But the reality behind NHI is that high quality healthcare is expensive and it seems unaffordable, even on this model. To put it in perspective, I've seen a lot of comparisons with the UK health system, the NHS. The NHS is funded with a budget of £180 billion. That's about 4 trillion rand. 4 trillion rand is nearly 3 times the total SARS tax revenue for South Africa annually. So that level of healthcare is just not going to happen with the kind of budget that we can get. In terms of a solution to inequality, perhaps it might be more successful at that because it will effectively make all South Africans members of the NHI and render medical aid schemes like Discovery pretty useless, because anything that can be covered by NHI cannot be covered by medical aid schemes, at least in its current form. So that would mean that all South Africans have an equal opportunity to go to either a private healthcare facility or to public healthcare. That might well improve healthcare for low-income families or for some low-income families, but it would simultaneously decrease the quality of healthcare for a lot of middle-class families. That might not seem like such a terrible proposition for the majority of people in this country.
And I mean, a lot of what has been said or what we know about some of the benefits is that for the very first time, people who ordinarily could not afford, private hospitals would find themselves getting access to hospitals. But talk to us about that scenario. What is government trying to achieve there in as far as, allowing then for everybody to have access to the best care in the country, essentially, by using private hospitals?
Okay, well, the general idea is this. At the moment, private hospitals are at around 60 to 70% capacity, meaning that there are open hospital beds in private hospitals. The NHI would act as essentially a medical scheme, much like Discovery, and through NHI, government would pay those private hospitals to, have members of the NHI, that is every citizen of South Africa, come and use their facilities. So those private hospitals would become full, essentially. They would be at capacity, one would hope. Now, even were that the case, currently that 60% capacity is made up by around 16% of the population. So if you filled those hospitals to capacity, that would mean around 23 or 24% of the population would be using private hospitals, and 76, 77% of the population would be using government hospitals. But it might not be the same people, right? So at the moment, every single one of the people in private hospitals like Fourways Life and so on are paying for private medical aid schemes, generally speaking anyway. And that might change, and people in low-income households will then be able to be using some of those facilities. But again, the vast majority of the population would still be using government healthcare facilities.
And let's talk now about, some of the things that have been said is that whilst the NHI is good on paper, we can't implement it given the fact that the country's healthcare infrastructure is essentially crumbling. What would then, be the most critical need if, for instance, the bill is then accepted into law?
it's very difficult to say how it would work, right? I think first of all, you need to work out who's going to get to use the private healthcare facilities and who's going to get to use the government healthcare facilities. How is it decided? Is it done on who lives near the private hospitals and who lives near the government hospitals? Because if that were the case, then immediately the house prices all around the private hospitals would rocket up. And everyone, I mean, look, for most middle class families, high quality healthcare is, is a must. So people would do their hardest to try and live near those private hospitals. And before long, you just end up in the same situation. You'd end up with middle class families, those people paying for paying their taxes, getting access to private healthcare facilities, and everyone else not. Anyway, I think funding is the main issue, and honestly I don't see a solution. Like I say, I mean the NHS in the UK costs 16 times more money than the current budget allocated to healthcare in South Africa. We have 259 billion is allocated to healthcare here. It's around 4 trillion rand in the UK. It's simply not affordable to provide everyone with high quality healthcare. So I think finding a system that will result in genuinely equitable healthcare for all South Africans is worthwhile. And also there's another major problem in that, if the middle class who will be paying for this bill, right? I mean, they'll introduce a tax much like national insurance in the UK, and probably let's just say most people will be paying roughly what they're currently paying for their medical aid now. If those middle class South Africans are paying what they are now for high quality medical aid, high quality medical care, but are suddenly being forced to use government healthcare facilities, that's just not going to be acceptable. And people will either look to move to where they will be in line for private healthcare, or it will just add to the emigration problem. The middle class will continue to evacuate. We'll have fewer and fewer taxpayers and less money to pay for this system. So I think funding is the major hurdle, and this is the issue that's being brought forward by all the stakeholders in this, really.
And as you say in your in a recent article you penned, currently 52% of the money spent on healthcare is spent by just 16% of the population. In an interview that I had with the IFP just a few moments ago, we're also hearing that we actually don't know how much this is going to cost on a yearly basis. Some say anything up to 500 billion rand, but it's only when the plan becomes clearer where we will have the idea. You talk about the fact that, having a system like this that does not work might push some South Africans away from our country. What does that mean then for the sector itself? We know that in many hospitals we are running short of healthcare professionals, whether it be doctors or nurses. But the other reality is we have a lot of professionals sitting at home.
Right. I mean, I must say I've spoken to quite a few specialists in private hospitals near me, and none of them are particularly concerned in the short term. And that's because they believe that this is going to be a long, drawn-out legal process. Thousands of jobs rely on the private healthcare sector, not least those in the medical aid schemes themselves, and they will be destroyed if the legislation, if the bill goes through as it is. Discovery Health will be completely destroyed. At least it seems like that on the face of it. So in the short term, I don't think we're going to see a massive outflow of doctors or anything like that. In the longer run, it's more difficult to say. I mean, the working conditions in private hospitals are very good at the moment, and what governments are saying is that private hospitals will continue to be private hospitals. It's just that government will pay them as if they were a medical aid scheme like Discovery. From what I hear from the doctors, government haven't always been very good at paying their bills. So perhaps, perhaps the money won't come in quite as efficiently as it does through Discovery. Perhaps the doctors might not enjoy working in hospitals at full capacity all the time. And when working conditions deteriorate, skilled workers like doctors and nurses start looking for work elsewhere, and doctors may become scarce. But as you say, there are a lot of doctors sitting at home in South Africa right now, and there are vacancies that aren't being filled. Ultimately, the entire healthcare sector in South Africa is being run extremely inefficiently at the moment. We have vast quantities of, what do they call it, irregular expenditure. We have whistleblowers against Gauteng Health being assassinated, and really the sector's a bit of a mess. At least the government-run sector is. The private healthcare sector, on the other hand, is functioning extremely well. Sure, I'm sure there are inefficiencies in places, but my personal experience of the private healthcare sector is exceptionally good, and one of the reasons why many middle-class South Africans continue to live in this country, because there is good access to good healthcare. But if the bill passes through as it is, that is at risk for middle-class South Africans. And whilst it may well improve the healthcare of lower-income households, and that's an excellent thing because the healthcare is, not good, it might well drive the taxpayers out of the country, and overall that's not good, because that tax money pays for schools, it pays for roads, it pays for higher education, it pays for SASSA grants, it pays for everything. Government doesn't pay for anything, the taxpayers pay for things. So it's really hard to predict where it goes, but I can envisage this going through the courts for a very long time before we see any reality, and I really don't think it's a massive coincidence that this is being pushed shortly before an election.
All right, Prof, let's leave it there for now. Thank you so much for that comprehensive analysis, of course, looking at the NHI. That is Professor Benjamin Smart from the University of Johannesburg.